Imagine waking up in the middle of the night to a burning sensation in your feet so intense you can barely stand to touch them to the floor. Or imagine struggling to button your favorite shirt because your fingers feel numb and tingly, like they don't belong to you anymore. For millions of Americans over 60, this isn't imagination. This is their daily reality. And here's what your doctor may not have told you. The worst culprit behind nerve damage and neuropathy isn't what most people think. It's not just diabetes or aging. There's a silent poison lurking in your bloodstream right now, destroying your nerves cell by cell, and most seniors have no idea it's happening until it's almost too late. Stay with me for the next few minutes, because what I'm about to share could save your nerves, your independence, and your quality of life. Hello, friends. If you're over 60, or if you're caring for an aging loved one, welcome. I'm so glad you're here today because we're going to talk about something that affects nearly 20 million Americans, most of them seniors: peripheral neuropathy. That's the medical term for nerve damage that usually starts in your hands and feet. Now you might be thinking, well, I know diabetes causes nerve problems, and you're absolutely right, it does. But what if I told you there's another cause of neuropathy that's even more widespread, more insidious, and far more preventable? A toxic substance that builds up silently in your body, damaging the delicate protective coating around your nerves, leaving them exposed and dying. This isn't about fear, this is about knowledge. Because once you understand what this poison is, where it comes from, and how to protect yourself, you can take back control. You can stop the damage, protect the nerves you still have, and in many cases even reverse some of the symptoms you're already experiencing. So let's dive in and talk about the worst poison destroying your nerves. The poison I'm talking about is something called homocysteine. Now, I know that's a big word, so let me break it down. Homocysteine is an amino acid, a type of protein building block that naturally occurs in your body. In small amounts, it's harmless, but when levels get too high, homocysteine becomes extremely toxic to your nervous system. Think of it like this. Imagine your nerves are electrical wires, and they have a protective rubber coating around them called the myelin sheath. This coating keeps the electrical signals traveling smoothly through your body. High homocysteine acts like acid on that protective coating. It eats away at it, damages it, and eventually destroys it. When that happens, your nerve signals misfire, get crossed, or stop working altogether. And here's the frightening part. Elevated homocysteine doesn't just damage the nerves in your feet and hands. It damages blood vessels throughout your entire body, increasing your risk of heart attack, stroke, dementia, and Alzheimer's disease. Studies have shown that seniors with high homocysteine levels are up to 3 times more likely to develop these serious conditions. But why haven't you heard more about this? Well, homocysteine testing isn't routine. Most doctors don't check for it unless you specifically ask, and many seniors are walking around with dangerously high levels without knowing it. The question is, what causes homocysteine to build up in the first place? Here's where things get really interesting, and where you gain the power to fight back. Your body is designed to break down homocysteine naturally using 3 specific B vitamins: B6, B12, and folate, which is also called B9. These vitamins act like a cleanup crew, converting dangerous homocysteine into harmless substances that your body can safely eliminate. But as we age, especially after 60, several things happen that disrupt this process. First, absorption problems. As you get older, your stomach produces less acid, and your digestive system becomes less efficient. This means even if you're eating foods rich in B vitamins, you're not absorbing them as well as you used to. It's estimated that up to 30% of adults over 60 are deficient in vitamin B12 alone. Second, medication interference. Many common medications that seniors take actually deplete B vitamins from your body. Medications for acid reflux like omeprazole or Prilosec, diabetes medications like metformin, and even some blood pressure medications can rob your body of these critical nutrients. If you've been taking any of these medications for years, your B vitamin levels could be dangerously low. Third, dietary changes. Many seniors eat less as they age, or they shift to softer, easier to chew foods that may not be as nutrient dense. If you're not regularly eating foods like leafy greens, eggs, fish, and fortified cereals, you're probably not getting enough B vitamins from your diet alone. When your B vitamins drop too low, your body can't break down homocysteine anymore. It starts to accumulate in your bloodstream, rising higher and higher, attacking your nerves day after day, year after year. And that's when the symptoms start. Many seniors dismiss the early warning signs of nerve damage as just part of getting older. But I'm here to tell you, these symptoms are not normal, and you should never ignore them. Let me walk you through the warning signs, from early to more advanced. Warning sign number 1, tingling and numbness. This usually starts in your toes or fingertips. It might feel like pins and needles or like your foot has fallen asleep, except it doesn't go away. You might notice it more at night when you're trying to rest. This is often the very first sign that your nerves are being damaged. Warning sign number 2, burning or stabbing. Pain. This is different from regular aches and pains. It's a sharp, electric, burning sensation that can strike suddenly. Some seniors describe it as feeling like their feet are on fire, or like someone is stabbing them with needles. This type of nerve pain is called neuropathic pain, and it's a clear sign that nerve damage is progressing. Warning sign. Number 3, loss of coordination and balance. Your nerves don't just carry pain signals, they also tell your brain where your body is in space. When those nerves are damaged, you might feel clumsy, unsteady on your feet, or like you're walking on cotton balls. This dramatically increases your risk of falls, which is the leading cause of injury-related death in seniors. Warning sign number 4, extreme sensitivity to touch. Some people with neuropathy develop something called allodynia, where even the lightest touch becomes painful. The weight of a bedsheet on your feet might feel unbearable. Putting on socks might hurt. This happens because damaged nerves send confused signals to your brain. Warning. Sign number 5, muscle weakness. As nerve damage progresses, it affects the motor nerves that control your muscles. You might notice you're dropping things more often, struggling to open jars, or having difficulty climbing stairs. Your muscles might even start to look thinner or feel weaker. Warning sign number 6, changes in blood pressure or digestion. In advanced cases, neuropathy can affect your autonomic nerves, the ones that control involuntary functions. You might experience dizziness when standing up, digestive problems, or changes in sweating patterns. If you're experiencing even 1 or 2 of these symptoms, please don't brush them off. Your body is sending you a message, and the earlier you respond, the better your chances of stopping and even reversing the damage. Engagement moment. Now, if you're over 60 or if you're caring for an elderly loved one, this information could be life-saving. I want you to take a moment right now and think, have you noticed any of these warning signs in yourself or someone you love? If the answer is yes, please keep watching, because in the next few minutes, I'm going to show you exactly what you can do about it. And if you're finding this information helpful, please take a quick second to give this video a thumbs up and subscribe to our channel. We create content like this every week specifically for seniors and their families, and I want to make sure you don't miss these important health tips. So, how do you know if high homocysteine is the culprit behind your symptoms? The good news is, it's simple to find out. You need 2 blood tests. First, a homocysteine level test. This measures the exact amount of homocysteine in your blood. Normal levels are generally below 15 micromoles per liter. Levels between 15 and 30 are considered moderately elevated, and anything above 30 is severely elevated and requires immediate attention. Second, a vitamin B panel. This checks your levels of B6, B12, and folate to see if deficiencies are causing your homocysteine to rise. Here's what I want you to do. At your next doctor's appointment, specifically request these tests. Don't assume they're part of your routine blood work. They're usually not. Write it down so you don't forget. Say, "Doctor, I'd like to check my homocysteine levels and my B vitamins, especially B12, B6, and folate." If your doctor asks why, simply explain that you're concerned about neuropathy prevention or that you've been experiencing some of the symptoms we discussed today. Any good physician will support you in being proactive about your health. And here's an important point. If you're already experiencing neuropathy symptoms, you should also ask for a comprehensive nerve function test, which might include nerve conduction studies. This will help your doctor understand the extent of any existing damage and create the right treatment plan for you. Now for the empowering part, what you can actually do to protect your nerves and fight back against this poison. The beautiful thing about homocysteine-related nerve damage is that it's largely preventable and, in many cases, reversible if caught early enough. Let me give you a comprehensive action plan. Step 1. Optimize your B vitamin intake. This is your most powerful weapon. You need to ensure you're getting adequate amounts of B6, B12, and folate every single day. For vitamin B12, seniors should aim for at least 2.4 micrograms daily, but many experts recommend even higher amounts for those over 60, sometimes 25 to 100 micrograms or more, especially if you have absorption issues. Good food sources of B12 include wild-caught salmon and other fatty fish, eggs, especially the yolks, grass-fed beef and lamb, fortified cereals and nutritional yeast, and dairy products like yogurt and cheese. However, here's the reality. Because of absorption issues, many seniors need to supplement. Sublingual B12, the kind that dissolves under your tongue, or methylcobalamin B12 supplements are often more effective than pills because they bypass the digestive system. For vitamin B6, aim for 1.5 to 2 milligrams daily. You'll find this in poultry like chicken and turkey, bananas, potatoes with skin, chickpeas, and fortified cereals. For folate, aim for at least 400 micrograms daily. Great sources include dark leafy greens like spinach and kale, legumes and lentils, asparagus, avocados, and fortified grains. Step 2. Consider a quality B-complex supplement. Talk to your doctor about taking a high-quality B-complex supplement specifically formulated for seniors. Look for one that contains the active forms of these vitamins: methylcobalamin for B12, pyridoxal 5-phosphate for B6, and methylfolate for folate. These active forms are easier for your body to use, especially if you have genetic variations that affect vitamin metabolism. Step 3. Review your medications. Sit down with your doctor or pharmacist and review every medication and supplement you're taking. Ask specifically, are any of these depleting my B vitamins? If the answer is yes, discuss whether you need to adjust dosages, switch medications, or add supplements to compensate. Common culprits include proton pump inhibitors for heartburn, metformin for diabetes, some antibiotics, and certain seizure medications. Never stop taking prescribed medications on your own, but do have this important conversation. Step 4. Support your nerves with additional nutrients. Beyond B vitamins, certain nutrients have been shown to support nerve health and reduce neuropathy symptoms. Alpha-lipoic acid is a powerful antioxidant that helps protect nerve cells and has been shown in studies to reduce neuropathy pain and improve nerve function. A typical dose is 600 milligrams per day. Magnesium helps regulate nerve signals and can reduce muscle cramping and pain. Many seniors are deficient in magnesium. Aim for 300 to 400 milligrams daily from food and supplements combined. Omega-3 fatty acids from fish oil help reduce inflammation and support the myelin sheath around your nerves. Aim for at least 1,000 milligrams of EPA and DHA combined. Vitamin D deficiency has been linked to increased neuropathy risk. Many seniors are low in vitamin D, especially if you don't spend much time outdoors. Have your levels checked and supplement accordingly, often 1,000 to 2,000 IU daily or more. Step 5. Lifestyle modifications. That matter, beyond nutrition, certain lifestyle changes can significantly impact nerve health. Limit alcohol. Excessive alcohol damages nerves directly and depletes B vitamins. If you drink, keep it moderate. No more than 1 drink per day for women, 2 for men, and some experts recommend less for seniors. Quit smoking. Smoking constricts blood vessels, reducing blood flow to your nerves and making damage worse. It's never too late to quit, and your nerves will thank you. Control blood sugar. Even if you're not diabetic, blood sugar spikes damage nerves. Focus on a diet rich in vegetables, lean proteins, healthy fats, and whole grains while limiting refined carbohydrates and sugars. Exercise regularly. Gentle, regular movement increases blood flow to your nerves, bringing oxygen and nutrients they need to heal. Even a 20-minute walk daily can make a significant difference. Consider activities like swimming, tai chi, or gentle yoga that are easy on the joints. Manage stress. Chronic stress increases inflammation throughout your body, including in your nerves. Practice relaxation techniques like deep breathing, meditation, or whatever brings you peace and joy. What to expect? The healing timeline. I want to set realistic expectations here because nerve healing doesn't happen overnight. Nerves are delicate and they heal slowly, but they can heal. When you start addressing high homocysteine and supporting your nerves with proper nutrition, in the first 2 to 4 weeks, you might notice some symptoms start to stabilize. The burning or tingling might not get worse, and you might have occasional good days. By 2 to 3 months, many people report noticeable improvements. The pain might lessen in intensity or frequency. You might regain some sensation you'd lost. After 6 to 12 months of consistent support, significant improvement is possible. Some people regain most of their nerve function, especially if they caught the problem relatively early. The key word here is consistent. You can't take supplements for a week and expect miracles. Your body needs time, and your nerves need sustained support to repair themselves. Also understand that the earlier you catch this, the better your outcomes. Severely damaged nerves are harder to restore than mildly damaged ones. This is why recognizing those warning signs and acting quickly is so important. When to seek immediate medical help. While I've given you a lot of information about natural approaches and prevention, I need to be very clear about when you should seek immediate medical attention. Go to your doctor right away if you experience sudden onset of severe weakness, especially if it's affecting both sides of your body or moving upward from your feet. This could indicate a serious neurological emergency, loss of bowel or bladder control along with numbness or weakness, severe pain that doesn't respond to over-the-counter pain relievers and is interfering with your daily life and sleep, wounds on your feet or hands that won't heal, especially if you can't feel them. This is particularly important for diabetics, as it can lead to serious infections, sudden changes in vision, speech, or mental clarity along with nerve symptoms, as this could indicate a stroke or other emergency. Neuropathy itself is serious, but it can also be a warning sign of other conditions that need medical treatment. Never hesitate to reach out to your healthcare provider if you're concerned. Real hope and encouragement. I want to share something with you from my years of working with seniors. I've seen remarkable recoveries. I've seen people who could barely walk without pain return to dancing with their grandchildren. I've seen hands that trembled and couldn't hold a pen regain strength and dexterity. Your body has an amazing capacity to heal when given the right tools. Take Martha, for example, a 68-year-old grandmother who came to her doctor barely able to stand for more than a few minutes because of burning pain in her feet. Her homocysteine level was 32, and she was severely deficient in B12 and folate. She'd been taking a medication for acid reflux for over 10 years, which had been depleting her vitamins the whole time. Within 3 months of starting high-dose B vitamins, reviewing her medications, and making dietary changes, Martha's homocysteine dropped to 11. Within 6 months, her pain had decreased by about 70%. She could stand, cook, garden, and play with her grandkids again. She told her doctor it felt like getting her life back. Stories like Martha's aren't rare. They're possible for you too. But it requires action. It requires you to be your own health advocate, to ask questions, to make changes, and to be patient with the healing process. You deserve to live your golden years with vitality, comfort, and independence. Don't let a preventable poison rob you of that. Summary. Let me quickly summarize what we've covered today, because this is important information to remember. First, the worst poison destroying your nerves isn't some mysterious toxin from the environment. It's homocysteine, an amino acid that builds up in your blood when you don't have enough B vitamins to break it down. Second, seniors are especially vulnerable because of age-related absorption problems, medication interactions, and dietary changes that deplete critical B vitamins, B12, B6, and folate. Third, the warning signs of nerve damage include tingling, numbness, burning pain, balance problems, extreme sensitivity to touch, and muscle weakness. Never ignore these symptoms. Fourth, you can protect yourself by getting tested, optimizing your B vitamin intake through food and supplements, reviewing your medications, and supporting your nerves with nutrients like alpha lipoic acid, magnesium, omega-3s, and vitamin D. And finally, healing is possible. Nerves can recover when given the right support, but it takes time, consistency, and a proactive approach to your health. Knowledge is power, and you now have the knowledge to protect yourself and your loved ones from this silent poison. Closing. Friends, thank you so much for spending this time with me today. I know this was a lot of information, but you stuck with it because you care about your health or the health of someone you love. That tells me something important about you. You're a fighter, you're proactive, and you're willing to do what it takes to live your best life. I want you to take action today. Not tomorrow, not next week. Today. Write down a reminder to ask your doctor about homocysteine and B vitamin testing at your next appointment. If you don't have an appointment scheduled, call and make one. Look at the medications you're taking and start that conversation about whether they might be affecting your nutrient levels. Share this video with your family members, your friends, your church group, or anyone else over 60 who needs to hear this message. You could literally save someone from years of unnecessary suffering. If you found this video helpful, please hit that like button and subscribe to our channel. We're here every week with vital health information specifically designed for seniors and their families. Click that notification bell so you never miss an important video. And I'd love to hear from you in the comments. Have you experienced any of these symptoms? Have you had your homocysteine tested? What questions do you have? Let's build a supportive community right here where we can learn from each other. Remember, aging doesn't mean suffering. You have the power to protect your nerves, preserve your independence, and enjoy the life you've worked so hard to build. Take care of yourself, stay informed, and I'll see you in the next video.